On the shores of Pantego Creek, at the mouth of the Pungo River, stirs a ripple of public dissent in Belhaven.
So please don't let them off the hook. It's not about Republican and Democrat. It's about people's lives.
Townspeople gather along with others from across the country, as well as civil rights leaders, to raise awareness for the current risk of closure to small community hospitals everywhere, and especially in Belhaven.
It is absolutely, totally devastating for a community to lose a rural hospital, a small hospital, because it's the biggest economic engine in most of the towns, and it's also a matter of life and death. People die needlessly if you don't have a hospital.
The plan is to walk 283 miles to Washington, D.C., each mile representing an at-risk rural hospital.
These rural hospitals are important to all of us, and it's not okay to close 283 hospitals under any circumstances.
Belhaven's Mayor Adam O'Neill walked this walk just last year when Vidant Health closed Belhaven's Pungo Hospital, citing revenue loss and concerns with maintenance and flooding issues of the 60-year-old facility, which is located next to Pantego Creek.
And some people look at me and say, well, you know, they don't really want me to talk about dying. This casket down here. Some people say, well, why? Isn't that a little too much? No, it's not too much. That's exactly what we're talking about.
It's stories like Portia Gibbs, who died while waiting for a helicopter just 1 month after the Belhaven Hospital closed.
Okay. A 48-year-old mother of two who spent the last hour of her life in the back of an ambulance in a high school parking lot. That's what happens. That's real.
And while, you know, Miss Gibbs had an insurance card, she had nowhere to go. And so, you know, she's about my age. She was a mom. I'm a mom. And I think it's important for everyone to have in the state what I have.
My mother, she's 80-some years old. She has a heart problem. And we're always in the emergency room. And when we used to just go straight to the hospital and get things taken care of. So they're really worried about their health right now because it takes so long for them to get there. Like my aunt, she has no transportation.
We used to have a hospital here they could come to for emergency, and now we don't have that. So they're having to go further, and the golden hour is critical for anybody's life and safety, and that golden hour is jeopardized, plain and simple.
And so they walk through the streets of Belhaven, past the empty hospital, and out onto the road to D.C.
As you go through the communities and they come out to see you, or they slow down and roll their windows down and give you words of encouragement.
Well, I've been involved in the civil rights movement for about 50 years. I grew up in Alabama. My daddy was in the Klan, my granddaddy was in the Klan, and I worked with Dr. King and Mrs. Rosa Parks in the civil rights movement, and this is the renewal of the civil rights movement.
Bob Zellner is no stranger to confronting civil rights issues. He organized nonviolent student marches and protests with Martin Luther King and Rosa Parks. Now a North Carolina homeowner, Zellner says rural health has to get attention.
This is very important on a lot of levels for North Carolina homeowners and residents. When we turn away the expansion of Medicaid and we close up rural hospitals, we're hurting our economy really badly.
Vidant Health, who would not comment on camera, due to an ongoing lawsuit filed by the town of Belhaven and the NAACP, sent this statement to UNC-TV, where they say, Vidant Health has worked diligently to continue to provide access to quality health care for the citizens of Belhaven and surrounding communities. The changing landscape of health care in eastern North Carolina is part of a larger national trend due to changes in both how care is delivered and how it is financed. Vidant Health says it continues to provide ambulatory care to close to 100 patients a day at a 24-hour family physician complex near downtown, as construction is underway on Vidant's 24-hour state-of-the-art healthcare facility to serve Beaufort and Hyde counties. But many who live here say a full-scale emergency hospital is what the town needs to sustain long-term economic and community success, and some believe they are close to reopening their hospital.
After our walk last year, we had a lot of optimism, we had a lot of help. We had meetings set up by the White House. We had elected officials come to help us. The governor of North Carolina is trying to help us with our hospital, and we'll get it open sometime late fall or winter, it looks like now. we're jumping through some hurdles, or jumping over some hurdles that we have run into here recently, but we'll get things done. We're going to get our hospital open back up.